When you look at some of the health inequities, higher rates of obesity, diabetes, depression, suicide.
Knowing an ACEs score sometimes helps you understand some of the barriers that we're seeing in terms of lack of compliance with medication management, lack of disease control.
Este es un programa muy bueno que sí ayuda bastante. Ahora estamos mejorando mucho más nuestra situación con la niña que tenemos.
Just like we screen for diabetes control, like we screen for asthma or any other number of routine screenings, ACEs also needs to become part of that screening strategy for every patient.
And so the opportunity is to come together as a community to really strengthen how we work together, how we strategize, how we really maximize our resources to think differently, to create a new reality for the families and the communities that we're hoping to serve here in Kern County and the greater San Joaquin region.
So I am a general pediatrician working in the Kern County area for over 20 years, my entire career. I have gravitated to the care of medically complex children, and through that work I began to collaborate with First Five many years ago, and we worked together to improve outcomes in our medically fragile children living in Kern County, of which there are thousands.
As part of my work, I lead our systems change work to really support the health and well-being of children and families across Kern County and the larger San Joaquin Valley. So ACEs Aware is a initiative from Dr. Nadine Burke-Harris and Governor Newsom to really support an understanding and training of medical providers, specifically Medi-Cal providers, around screening and treating adverse childhood experiences for children and adults.
There can be a negative perception when you ask these questions, especially if you don't preface. It feels intrusive, and especially if you have experienced trauma in your life, it can be triggering. We've done a few things to help mitigate that process. We preface our screens with written instructions that kind of explain why we're doing this, how it can potentially be triggering, and what we plan to do with that information, which is to use it exclusively for the health and benefit of the patient.
Jackson and Kingston were born at 25 weeks gestation. They only weighed 1.5 pounds each when they were born.
And my name's Kingston.
I've had many health issues and had to have lots of different screenings done, but this was the first time that we did an ACEs screening. And it was important to me because of being able to do more preventative measures instead of having reactive measures that we've had in the past with their health care and trying to take care of them the best that we can.
So the vision for ACEs in Kern County is to really build an ecosystem of partners that are coming together to think about how we are coordinating the work that we're all doing to really support children and families across Kern County.
So it's a natural fit really between our agencies in terms of the work that we do, and we're excited to collaborate with First Five, and we're really excited to implement the ACEs screening as a pilot within our clinic.
It's brought awareness of things that we didn't realize that some people think are normal in their household, that are abnormal, or things that they think are acceptable and they're not. So it has helped me to have more compassion when viewing other people in the community, because you never know what someone has going on in their household.
Todo lo que hemos recibido, toda la información que estamos recibiendo es muy conveniente para toda nuestra gente, para nosotros que hemos tenido ese problema.
It's very crucial to our mission as an FQHC, as a safety net organization for the most medically vulnerable folks in the community that we address every possible cause for worsening their disease.
Muchas cosas, a veces cuando unas cosas que no le entendemos bien o nos falta información, siempre hablamos con la doctora Raúl y ella nos da toda información, lo que nosotros necesitamos, y por eso es lo que sabemos de eso.
We see this as an opportunity to really maximize the impact to serve children. When you look at some of the data here in Kern County, more than 18% of all households have an ACEs score of 4 or more. When you look at some of the health inequities, health outcomes that result from that, right? Higher rates of obesity, diabetes, depression, suicide. These issues are the issues that are impacting our children, our grandchildren, the families all around us that we're serving as providers, as medical staff, as advocates doing case management work. And so when you think about ACEs and any life or traumatic event that has happened to you, what the data shows us is that we have all experienced ACEs.
So we're really excited to be partnering with First 5 Kern County around their ACEs work. We are also partnering with them around their Help Me Grow and their home visitation work. So when you think about, their role in the community as really being that catalyst to bring partners together around a shared system of care for families, but to also provide them the data as a funder of our kids' resources in this community, real-time data that they can use to help inform the decisions and the investments they're making in those systems.
I know that there are a few people that were hesitant at first to join because, either they felt like they were using too many systems already. They felt like there was a duplication of services. But then once they joined, they were able to see that it actually saved them time. Because, once you submit a client, any organization submits a client, that client is now available on the network to pull up their record multiple times. The best thing about KCCN is that it's a closed loop system, so you're able to take a look at the status of these referrals.
I think it's exciting to start, but there are some very real barriers we've identified that we need to work on going into the future. Building trust is very, very important. Addressing those cultural issues and beliefs is also really important. Getting honest responses is something that we struggle with. And then there's time constraints. And that goes to the bigger picture of when you want to provide a whole person care and you want to screen for ACEs and you want to screen for other triggers of chronic health, you need time. If there's one thing you could do to improve life expectancy, improve quality of life, decrease your chance of getting a chronic illness, why wouldn't you do it? It very much belongs in the primary care setting, and it very much should be a standard process along with all the other screening tools that we administer.
And so what we're hoping to do as we're building out this ecosystem of partners, organizations that are committed to this work, is to really find those champions within organizations, within the medical community, to really transform how we're working together to really support the communities that we're serving day in and day out across Kern County.